Okay, be honest. How many times this week did you think, let's just avoid hormones to be safe? Here's the uncomfortable truth. Most women you're seeing in clinic are candidates for hormone therapy. And withholding it from symptomatic women isn't just out of step with current guidelines and research, it could actually be harming the very patients you think you're protecting. I'm Dr. Kelsey Sherman, a board certified family medicine physician, Menopause Society certified practitioner, and co-owner of Ovella Health. I prescribe hormone therapy every single day. And I, along with Dr. Kelly Baxter, am here to help you feel more confident in prescribing hormone therapy in perimenopause and menopause. So, in the next few minutes, let me walk you through a few of the contraindications you may have in your head that actually aren't. Because the biggest barrier to prescribing isn't confusion around dosing or formulations, it's fear. Fear left over from a single headline in 2002, where we accepted the outdated adage that estrogen is dangerous and should be avoided, without ever looking into the data ourselves. And most of us received little to no training in menopause, a stage of life that 100% of women who are lucky to live long enough will go through. Let that sink in for a moment. And now, let's be part of the movement to change it. So, let's play a quick round of yes or no. Are any of the following contraindications to hormone therapy? A woman with high blood pressure, migraine with aura, cardiovascular risk factors like high BMI or smoking, a family history of breast cancer, a woman who's known BRCA mutation positive, a woman over the age of 60, a woman with a history of a blood clot. No. Not a single one of those women has an absolute contraindication to starting estrogen. Every one of them could be a candidate. It's up to you to guide the right formulation, like oral versus transdermal, and the right dose. But every single one of those women could be safely started on estrogen if they chose to. And it isn't just us saying it. So are the major medical organizations like the Menopause Society, the American College of Obstetricians and Gynecologists, and the International Menopause Society. And I know you may have an uncomfortable feeling inside, thinking surely for some of those women, isn't it safer to avoid estrogen rather than starting it? But let's not forget that there are real risks to not prescribing hormones as well. Did you know that starting estrogen within 10 years of menopause is associated with a lower risk of cardiovascular disease? And the number one killer of women is not breast cancer, it's heart disease. So, in focusing on only an ingrained fear of breast cancer, but one that is not well documented in literature, we could be causing harm to women by losing out on an opportunity to reduce their risks of heart disease, as well as their risk of osteoporosis and other menopause-related diseases. This is our mission, to change women's healthcare, to fill in the gaps in knowledge that we know were skipped over in your medical training. We built our course to teach you everything you need to know about hormone therapy, step by step, which hormones, formulations, and doses are right for each patient, so you can practice with confidence. Grab the free Is My Patient a Candidate cheat sheet to start, and then when you're ready to actually feel confident in prescribing, join us. Stop being the reason your patients can't get care that's safe and effective. Let's make this your most confident area of medicine instead of your blind spot. I'll see you on the other side.